This parent has a 2-year-old who mouth breathes and has a small jaw. They told their doctor and their dentist, and they're like, they'll grow out of it. We're not really worried. However, the parent's worried and wants to do something. So I said, what can I do? Well, the first thing I would do is teach your 2-year-old how to blow their nose. And then use a spray like this xylitol spray called Xlear, and every single night spray their nose, clean it out, because I think that part of a healthy mouth is having a clean nose, and this will make it easier for them to breathe through their nose. The other thing is, at 2 years old, we're just going to begin the process of understanding the root cause of this mouth breathing. So the parents first brought up, hey, the jaw is small, kind of like this, the teeth are crowded. So if that's the case, you can't do an expander yet. I'm going to wait in my office. We're going to do that 4 years old at the earliest. So we're going to do some at-home myofunctional appliances. So that's something like a Myomunchee, a Myobrace, or Healthy Start. These are things that aim at making the jaw a little bit bigger, putting some pressure on them, the child getting their lips stronger to close their lips and their tongue up. So some ideas to begin to move the jaw and the muscles of the mouth in the right direction, but you can just do it on your own at home. And then the next thing you're gonna wanna make sure is, does your child have a tongue tie? So check under their tongue. Is there a string holding their tongue down like this? If that's the case, hold the tongue in the bottom jaw. They're gonna be much more likely to mouth breathe. The third thing you wanna look into is their tonsil size. Have them open big, stick their tongue out, check in the back of their throat. If you see big tonsils like this, it's very hard for them to breathe, so they're opening their mouth to make their airway bigger because they have these massive tonsils affecting their airway size. If that's the case, they're also too young to go to the ENT or do some kind of surgical procedure. So what you're going to want to do is just text our office and we'll send you like our holistic tonsil reduction guide. But that'll just talk about some foods that you can take or reduce and some allergens that you can reduce that might make the tonsils a little bit smaller. The other thing, while we're on the topic of allergies, is the fourth thing I would look up is allergies for my child. Do I think that there's some environmental allergies, some dust allergies? You know, you're not going to be able to get your 2-year-old allergy tested at this age. You have to do a scratch test or a blood draw. But what you can do is just some things around their bedroom or around the house, such as air filters. You could remove stuffed animals from their bed, make sure they don't have a down comforter, change their sheets very regularly, remove any carpet from the room. These are things that I would start with on my 2-year-old to begin to understand why they're mouth breathing and take a couple steps to help.